Hello, hi, good morning. Welcome from Aero Medical Solutions. I'm here to talk to you today about pilots with obstructive sleep apnea. So, when you have obstructive sleep apnea, that does not preclude you from flying. However, it does make us concerned about your oxygen saturation to your heart. So if you are not controlled, then we do have an issue with that. If you're controlled, we do not have an issue with that. When you first try to get your obstructive sleep apnea special issuance, you will need your sleep study, your formal sleep study from your sleep specialist, as well as a compliancy report on your current CPAP machine. When you're trying to keep up your obstructive sleep apnea, then we have a couple different things that we do look at. We always ask about the initial or most recent diagnostic sleep study. If you have that, then that would be beneficial for your AME, as well as was it an in-house, was it an at-home test, kind of things like that. And then what is your diagnosis? Is it primary obstructive sleep apnea? Is it central sleep apnea? Do you have restless leg syndrome? Do you have narcolepsy, insomnia? So each one of those will be identified in your sleep study. And then we also ask if there's any disruption or sleep issues in terms of RLS. If you have periodic limb movement, some of us can levitate while we sleep, and so that can be part of the issue as well. And then we also ask about how many central or hypopneic episodes you will have. That will all be reported on your report that you bring to us, so we will be able to answer those questions for you. And then we ask if you have any increased risk of obstructive sleep apnea that would potentially cause some more concern. Atrial fibrillation, congestive heart failure, coronary artery disease, diabetes, hypertension, stroke, or morbid obesity. And then we want to know, what is the recommended treatment course? Is it a surgical device? Is it a nerve stimulator? Is it a CPAP machine? Is it weight loss? Is it motion, basically positional therapy, trying to lay on your side and not your back kind of situation? And then we also want to know, are you using any sedating medications? Ambien, which is zolpidem, trazodone, ropinirole, gabapentin, pramipexole, Benadryl, or diphenhydramine. Those all can mess with you as well. When we get your compliance report, we want to know the data that it's used for. So it has to be 30 days of a newly diagnosed treated, or based on a treatment of 365 days in average. You can bring that to us. And then we want to know that it's 75% or more that is acceptable. If it's less than that, it's not acceptable use of your CPAP machine, unfortunately. So what that means is like 6 hours or more. Your therapy for your AHI, which is your apnea-hypopnea index, should improve as time goes on as well. And then we just want to know how you're feeling. Is the treatment helping? Is the CPAP machine working for you? Are you tired when you wake up in the morning? Do you fall asleep very easily throughout the day, to include even in traffic? Things like that. If you have all of the sleep apnea report as well as your compliance report, we don't have an issue with you flying typically.